So the VideoMD Transitional Care Program is at its core a patient education and patient engagement tool that focuses on the transitional care period, which is the 30 days after a patient is discharged from an acute care or subacute care hospital. This is a very difficult time frame to take care of patients because of the siloed care in America with the hospitals and the inpatient physicians on one hand and the outpatient physicians on the other. With very little overlap, it is a very difficult time period for patient care. So in addition to being a patient engagement and patient education tool, the VideoMD Transitional Care Program will provide a platform that will help the hospitals and the outpatient physicians collaborate on the patient's care during the transitional care period. Some recent changes in government regulations have created an opportunity to build a program such as ours. The hospitals are currently being penalized 1% of their total Medicare billing if they fall in the lower tier of hospitals as far as 30-day readmission rates. In addition, outpatient physicians now have new Medicare transitional care codes, which are billing codes which help the outpatient physicians become more involved in the transitional care period and then bill for the care they provide during the transitional care period in hopes to lower 30-day readmission rates. So the VideoMD Transitional Care Program is a web-based program. Patients will be getting emails throughout the transitional care period. If the patients don't check email every day, we ask them at the beginning of the program, and we ask them to engage a caregiver or a family member to help them with the program. So they will be prompted throughout the month to watch quite a bit of video-based content. These are short educational videos. We have some great content on videomd.com, and they will be getting diagnosis-specific educational videos. There will also be some non-video content throughout the month. And then we're going to be tracking certain data points. These data points will be diagnosis-specific, and we will be tracking the data points and then reporting them to the hospitals and outpatient physicians throughout the month. We will alert the hospitals and the doctors if there's a change in the patient's data points, and they can take the appropriate steps to change the patient's care during the transitional care period. In addition, we're going to be tracking educational insights. We ask the patients if they learned anything from the content we provide, and then we'll be reporting these as well to the hospitals and doctors, and then also re-showing these to the patients so that they can relearn what they learned throughout the course of the month. At the end of the 30-day period, we will be gathering the information for each of the patients, and then we will bill the transitional care codes for the outpatient physicians so they can capture these new, more lucrative transitional care codes. Most outpatient physicians would not be able to capture a lot of this, the new transitional care codes, as they don't know when their patients were admitted, let alone discharged from the hospital. So we'll be providing them an alert that the patient is discharged, and then helping them provide the care throughout the month. We think there are a number of great innovations in this program. We know it will provide benefit to the outpatient physicians by helping them take better care of their patients during transitional care period, and then helping them to bill for these new, more lucrative transitional care codes. And then we also are going to provide benefit to the hospitals by helping them to take better care of the patients and lower their 30-day readmission rates. We have built most of the program. We've had quite a bit of feedback from our first pilot site, Baptist Health of South Florida, and we expect to have a full pilot program started in about a month in October, where they are going to enter all of their congestive heart failures into the VideoMD Transitional Care Program, and that will be our first pilot site. We are looking forward to getting that started, and then ultimately getting this program to the marketplace, and we're excited. Thanks.